Today's video is about an old therapy that people used to use for neurosyphilis that might seem quite shocking to people today. But it actually garnered a Nobel Prize when it was developed. So we've talked about syphilis before. There's multiple different stages of syphilis. One stage is called tertiary syphilis or neurosyphilis, and it can slowly erode a person's mind. It can slowly disable them, make them unable to walk. And it was the feared late stage complication of syphilis for which there was no treatment. And it sometimes was called general paresis of the insane. It had all of these different names. And we still check people who have dementia or who have mental status changes for syphilis because this is a well-known complication of this bacterial infection. One of the hypotheses was that the syphilis bacteria could not withstand high temperatures, and high temperatures would cause the bacteria to die. So there was this idea that, and they knew that malaria gave people high fevers. So there was this idea to give people malaria intentionally with the idea that, or with the intention that the fever that the malaria parasite caused would impact the syphilis bacteria and kill it. So this was called a malariotherapy, and it was pioneered by an Austrian psychiatrist named Julius Wagner-Jauregg. And in 1927, he won the Nobel Prize for this innovation. And of course, it doesn't sound like an innovation now because we've got antibiotics. But remember, we weren't using antibiotics for syphilis until the 1940s. And when antibiotics became available for syphilis, malaria therapy went away. It's also important to remember that they weren't using the worst type of malaria, falciparum malaria. They were using a lesser form of malaria called vivax malaria. But still, obviously, there's ethical concerns, but you have to put it in the context of the fact that they had no treatment for malaria at that time. And that's what they were putting forward. And this is the interesting story of malariotherapy, or infecting people with malaria in the attempt to cure neurosyphilis.